Good evening, everybody, and welcome to our webinar tonight with Health and Hygiene F10 Veterinary Treatment Application in Small Mammal Patients. This is our third webinar in the series, and we are really very fortunate and happy that you decided to join us. I'm just quickly going to go through a short video to show you how to navigate through the platform, how to use the platform, how to ask questions to our speakers. So sit back, enjoy, and we'll see you and get started in about 3 minutes' time. Thank you, everybody, for your attention to that video. So let's get started with our webinar tonight. I have with me online Dr. Neil Forbes and Dr. Molly Varga-Smith, and I have a lot of the F10 people in the audience as well. I see Linda's there, and she'll be covering us on that end as well. And it's so nice to see some of our familiar faces, Prof. Petty and Vilmay, and so many of the people that join us on a regular basis. So let's get started. It is my honor and privilege to introduce your host for tonight, Dr. Neil Forbes, who is currently based in the UK, but he's actually a closet African still. He owns property in South Africa, and he spends as much of his time as he possibly can here, giving his time and expertise freely to causes such as the vulture conservation and the training of vets in avian orthopedic techniques. He is a diplomat of the European College of Zoological Medicine, a recognized specialist also in avian medicine. His teaching is second nature for Neil, and he has lectured internationally for many, many years and has contributed to over 65 peer-reviewed papers and more than 38 books as well. So I know that I promised him that I won't go on and on about his impressive career tonight and his contribution to the best profession. so humble. And he likes us to refer to him as retired, but we know that is absolutely not the truth. So Neil keeps himself busy with consultancy work revolving around zoo, local authority and welfare inspections and trainings, as well as teaching. He's also involved with expert witness roles, captive breeding and conservation projects such as the Hubara bustards and critically endangered species of vulture. He's also currently the veterinary advisor to health and hygiene. And we are very, very privileged, Dr. Neil, to have you here tonight, as well as Dr. Molly Varga-Smith, to share both of your knowledge and your experience with us tonight. I'm now going to hand over to Dr. Neil. The floor is yours.
Thank you very much indeed, Corny. It's, I have to say, a really great pleasure to be here chatting with you tonight, and especially for me, a great pleasure to, as my presenter, to have Dr. Molly Varga with me. Molly and I have done quite a lot of work before together. We've lectured together and so on, and we enjoy it. We have fun doing these things, so I'm really looking forward to it. So just to introduce Molly, Molly graduated from the Royal Veterinary College in the United Kingdom in 1992. After graduation, she spent the next 4 years working in small animal and exotic medicine in Canada. Her roles varied experiences, including working in multi-centre urban practices in Toronto and a small exotics practice in rural Ontario. Her caseload included a lot of native wildlife, such as raccoons, skunks, and red-tailed hawks. After returning to the United Kingdom in 1996, she has worked in both London and in the northwest of the UK. Molly gained her certificate in zoological medicine in 2001 and her diploma in zoological medicine in the mammalian field in 2007. Molly currently runs a very busy first opinion and referrals exotic service in a well-known referral practice in Merseyside in the northwest of the UK. So welcome, Molly. Great to have you here.
Thank you very much.
Pleasure.
You know, it's an honour.
No, come on, calm down. But no, it's lovely to have you here.
That was the parrot.
I'm really looking forward to it. Now, before we start, I just want to say that if you are someone who doesn't speak English as a first language, that within 48 hours or so of this presentation, the recording will be on the F10 YouTube link. And on this first page here, you can see there's a link to the YouTube. And if you go on there and listen, you can actually turn on subtitles in your own language, so that that can hopefully enhance your appreciation and learning ability from the presentation. Okay, so just really to explain where we're coming from, so it gives me great pleasure to introduce F10 in the respect to the care of small exotic mammals. So we're not talking about cats and dogs, we're talking about little exotic people. And I'm doing that both as the health and hygiene veterinary advisor, which is a role that I'm very pleased and passionate about, but also as a user of F10 products myself for some 20 years. So, you know, I have great confidence and respect for the products. And that's why when I was asked if I would take up this veterinary advisor role, I was delighted. And here we are. So let's just ask ourselves, what makes F10 different? Well, unlike most, if not all other disinfectant and treatment disinfectant products, the safety testing of all finished products, so it's not the constituent parts, it's the finished products, is carried out by government accredited quality controlled laboratories. And that's in respect of skin, oral, dermal and inhalation safety. There's also efficacy testing, so not only is it safe, but it's proven to be effective, again, of all finished products by government accredited quality control laboratories. And there's a considerable information, not just testimonials, but all the safety and efficacy data that I've referred to, all the application instructions, the dilution rates, the contact times, is all available on the F10 Products website, and the link is there for you at the bottom. So we're going to make sure that none of you go to sleep tonight, hopefully. And part of doing that is we're going to keep asking you some questions. So you've got to keep on your toes, because we might ask you a question about something we just talked about. So first question is just a bit of background information. It gives us some quite interesting information. And you answer all of the options which are correct to yourself. So if you go on to your polling now, and you can see that option A is, I am aware of F10 and use at least one product. B is, I only use F10 products for cleaning and disinfection, cleaning and biosecurity. C is, I use F10 products for disinfection and also for patient treatments. D is, I wasn't aware that F10 products were licensed for patient treatment. And E, I use F10 for fogging on a regular basis. So if you can poll away, and we will then see what everyone thinks.
Dr. Neil, I'm not sure if you can see the results coming in so far, but we have about 31 votes, 32 votes.
I can't see the results at the moment, Connie.
Okay, so let me do running commentary for you. It's like off to the races we go. So we've got about 40% of our audience saying number C. They use the products for disinfection and also for patient treatments. That now went up to about 42%. Then second is, I am aware of F10 and use at least one product, about 31% of our audience. And about 19% says they use F10 by fogging on a regular routine basis.
Good.
Only one person wasn't aware that F10 products were licensed for patients' treatment.
Okay.
And that will change by the end of this webinar.
Yeah. Good.
Do we close the vote?
Okay, so
2 more seconds and let's close the vote. Perfect.
Okay. So I didn't get my results coming up. I don't know whether I was supposed to or not. But anyway, thanks very much. That's useful information, and we will be questioning you about clinical matters as we go along. Okay, so on we go. So we're going to start first of all this cute little hamster. I know, I do appreciate that, of course, depending where in the world you are, the patients we're talking about may be different species to the ones that you see in practice or that you own. But I just want you to think laterally, because the things that we're talking about are just as applicable to other little rodents and so forth. So do you use your imagination? And we're always really interested if someone is using F10 in a way that's different to how anyone else has thought of before. Actually, that's really interesting and useful. So do share that with other people. So just to introduce the hamsters, they have, you can see this little hamster, his cheeks are absolutely stuffed out, because hamsters have this habit of storing food in their cheek pouches. And if food gets stuck there or sits in the cheek for too long, you can get both bacterial and fungal infections arising, leading to a stomatitis, so inflammation and infection in the mouth. Those are common. And also commonly then leading on to cheek pouch necrosis. Now, obviously, we would always encourage people to take a swab. One thing not to do is don't try sniffing a hamster's mouth. It's really not good, because you'll get a bite on the end of your nose. But if you put a swab inside the hamster's mouth and twirl it around and then bring it out and smell the swab, that's really good. And then doing a little slide test and doing maybe a diff quick test on it to see whether you've got candida, whether you've got bacteria, are they gram positive, are they gram negative, and so on. That can be really, really useful. And obviously a culture and sensitivity is a great thing to do. But of course, in this situation, F10 SC at a 1 in 250 dilution is really, really good just to use as a daily mouthwash, because we know that putting F10 in an animal's mouth doesn't cause any harm. An animal drinking F10 doesn't cause any harm, but of course it's broad in its activity, so it will both be effective against bacteria across the board and also candida. Molly, have you got any particular sort of small mammal mouth infection cases to share with us?
Yeah, no, definitely. So we see this type of thing in various types of hamsters. So the very, very tiny sort of Roborowski's hamsters, to the much bigger Syrian hamsters. And again, as Neil says, it is a very common thing. And I've got to say, with some of the very tiny ones, I don't know if you have a top tip. I really struggle with holding them and doing the mouthwash and getting it accurately into the pouch, which is really what you want to do. And the pouches are sort of located on each side. The other thing, and again, it's the top tip for this species in particular, is we need to kind of look into if there's a why this is happening. Why is it sort of storing food and not then eating it? Why is it all getting stuck? And in terms of this, you know, we absolutely need to use F10 as part of probably a multifocal approach, if you like. So looking at husbandry, food provision, whether this little animal is perceiving itself to be being predated, and that's why, you know, it's inhibited from, you know, eating the food in its pouches, all sorts of things like that. So very, very definitely, as far as these guys go, it does need to be as part of a multimodal approach, because F10 in and of itself will certainly deal with the bacterial and fungal stomatitis and, you know, help resolve that. But it doesn't look at the root cause. So it, as I say, it's very useful as part of a multimodal approach. And we also, you know, we use it in a lot of these very tiny animals, you know, for direct wounds and that type of thing as well. You know, that can equally be caused by environmental issues or husbandry issues, as well as sort of just defined disease.
Great.
I mean, Neil, do you have any top tips about getting this into
the... A lot of people handling hamsters tend to just scruff them. And of course, there's two issues with that. They wriggle around like anything. The eyes tend to pop out, and it's altogether pretty unsatisfactory. What I've taken to doing in the more recent years is actually to put thumb and first finger. So I'm right-handed. So I'll put my thumb and first finger of my left hand actually underneath either side of the hamster's cheek, and bring the thumb and finger together underneath the hamster's chin. So it's not tighter in front of the trachea, but it does actually hold the head still. And then I just pop a cotton bud in the side of the cheek, and by keeping it pushing laterally, I can go quite smoothly into the back of the pouch there and don't have an issue. But I think it's all about holding the head still, not being bitten, and not letting the eyes pop out. So it depends on the size of your hand and everything else, I guess. But yeah, it's certainly, and I think one of the points you touched on there, Molly, with these very, very small patients, it's often actually very challenging and quite difficult, really, to use conventional medication. You know, if you were using antibiotics or nystatin or something, actually measuring volumes that were small enough for such a small patient can be really challenging. And also, of course, you have to very often open a big bottle to give a little bit to a hamster. And then if you charge the owner for the whole bottle because you're not going to use it for something else, you know, that's a challenge. Whereas, you know, literally, if you, and I would with F10, if I'm dispensing it, I would always dilute it. I don't, if I'm using it on a treatment basis, I don't like to give it out concentrated. So I'll often actually put it in saline rather than in water, and let the owner take that home. And for me, it often works really, really well without having to use a sledgehammer to solve that problem, but getting a really good resolution. Okay, so let's go on, see what we've got next. Okay, so we've got another polling question here. What makes F10 SC 1 and 250 so ideal for the treatment of stomatitis in hamsters? So answer A is hamster stomatitis is self-limiting and will resolve without intervention, but the application of F10 gives the owner something to do without any risk of causing any harm. Interesting. F10 is dangerous for oral application in hamsters, commonly resulting in dysbiosis. Or C, F10 tastes bad to hamsters, resulting in significant hypersalivation and should not be used for oral treatment. Or D, F10SC 1 in 250 is proven safe in contact with mucous membranes and for ingestion. In addition, it has a very wide range of efficacy against a very wide range of bacteria, viruses, and also fungi, including Candida. Or E, F10SC 1 in 250 is safe and effective, but moreover, it is safe and effective for an owner to apply daily at home, although it does increase antimicrobial resistance. So, if you all poll away.
Neil, sorry,
yeah.
I'm just going to interrupt. I just have a small technical glitch and I can't get the poll to publish. So you do have the poll questions on the screen. So I would appreciate if people could maybe just in the chat choose A, B, C, D, or E, and we can gouge with it. And I'm going to try and just sort out the technical thing glitch at the back end.
Okay. Hopefully no one is asleep and you'll find this one really quite easy.
Well, they'll have to put it in the chat. Let's see if there's a lot of answers coming in for D. D.
Good.
So we've got,
Nobody's asleep. Ds. Definitely nobody.
I can only see D's coming in so far.
Lots of people are getting involved here. Brilliant.
So Molly, can you see the poll results?
I can. I'm looking at the chat now as it's coming through.
Okay.
There's a lot of people replying. I'm just seeing D's and D's and D's. So
yeah. Okay.
The poll has now been published.
Okay. We should normally see a bar chart once we've finished voting with all the results, but for some techie reason, unfortunately, that's not with us this evening. Okay, well, how are we doing, Corné? Is everyone, or lots of people voted? Enough people voted?
I think so. There was a lot of votes in the chat, and on the polling that's now been activated, we've got 100% of people choosing option number D.
Well done, everybody. Take a big star on your back and have an extra glass of orange juice or whatever. Excellent, jolly good. Okay. So let's just talk about other peri-oral conditions. Molly, this is something I know you're close to your heart, so you take it away.
Yeah. So I think that when we were sort of talking about this webinar, we were talking about realistically how we commonly use F10 in practice. One of the conditions where I find it very, very useful is in cheilitis in guinea pigs. Now, we see this quite commonly, and we see sort of cracking and soreness and redness at the sides of the lips and actually the philtrum sometimes under the nose. And it can be very difficult to treat. The animals do get very uncomfortable, and they can also be very, very reactive to what you apply to that area. And so certainly for those patients, we found that the F10 Germicidal Barrier Ointment has been really, really useful. So both as a treatment directly, particularly because the contact actually does deal with bacteria and fungal elements to this condition, but also particularly as a barrier ointment. And I think that's really, really important, because as soon as these guys start having soreness around lips, again, their mobility in that area is sometimes a bit compromised, and you can get saliva and wetness in that area as well. So from that perspective, it has been really, really useful as part of a comprehensive approach to this kind of thing. And often with guinea pigs, cheilitis is a sign that there's a little bit of something else going on. Their immune system isn't great. Perhaps we don't have enough vitamin C. Perhaps they, have a slightly increased requirements. But in terms of that animal, one of the things that makes the animal in front of me feel better, literally directly, is actually applying this barrier ointment.
Sure.
because it just moistens that area, makes it a little bit more mobile, and makes it quite a lot more comfortable. And again, it's similar to what we see in rabbits.
Yeah,
You know,
but as you say, that if you put that barrier on there, you're stopping the skin getting wet, you're stopping the secondary infection, you're stopping the inflammation. Therefore, the animal's not uncomfortable, and it, all of a sudden it's eating better. It's a happier guinea pig, and everything's good. But as we say on the slide here, of course, the other common cause of excessive salivation is dental disease. And okay, fine, the dental disease has got to be treated, but actually using F10 barrier ointment as a barrier ointment specifically to clip the hair off, put the ointment on to actually prevent the wetting and the secondary infection and inflammation is really good. Whilst we're on this one, because we're talking about sort of head-end things, and I just suddenly realized that there's something I've discussed in some of these other presentations simply because I've had a number of birds with a yeast conjunctivitis.
Oh, wow. Okay.
Now, have you ever had a small mammal with a yeast conjunctivitis?
I've got to say, I don't believe I have. I've had some where we've failed to culture anything.
Okay.
But again, so I'm interested. Am I missing?
Well, I mean, maybe, but I say I had these two cases where, I'd done a swab and did I did run a cultural sensitivity, but more importantly, I did a diff quick stained slide. Did cytology. I think that's the key thing. Yeah, and I think this is a really good take-home message for clinicians: is you don't just reach for the first tube of antibiotic ointment, that actually taking a swab and doing cytology and staining it and seeing what's there. But I've certainly had these two cases where the animals. One was an eagle owl that had cataract surgery, and within 48 hours of cataract surgery, it developed this really, really angry episcleral congestion and conjunctivitis, and that was a yeast. And I had a cockatiel as well. And if you start,
were they on antibiotic eye drops at that point?
I don't believe so. Oh well, the eagle owl will have been, yes, absolutely, yeah. Because perioperatively, it would have antibiotic eye drops. The cockatiel, I don't believe so. But I think, the point that I wanted to raise is that if you have that situation, because we know that F10 SC 1 in 250, to put in the eye, I'd probably drop it down to 1 in 500. Yeah. But we know it doesn't cause corneal inflammation. Therefore, if you try and purchase a proprietary antifungal eye drop, it's certainly in the UK and in Europe, it's impossible. You can get them made specifically to your patient, but it takes about 4 to 6 weeks and costs an awful lot of money. So I've just used F10 drops in the eye, and within 48 hours, in both cases, perfect resolution.
I think that's so interesting.
And it just shows you how safe it is and how versatile. But yes, make your diagnosis first, and then don't use the wrong thing, but work out what you can use to control the problem.
Yeah, I mean, I think your point about doing the cytology, and I think sometimes we cut corners in that way, and actually we do miss some of the obvious and very basic things, because if you do a culture, obviously you're waiting 4 or 5 days, but equally you may not culture that kind of a thing. So I think that's a really useful take-home message. And
really where you're just trying to work out, is it bacterial or is it fungal? It could be birds are a lot of my patients, but you had a crop infection in a bird, and commonly it's bacterial, commonly it's fungal. You need to know, and actually doing that cytology sample and staining it and having a look, the answer, the right treatment straight away. Okay, let's go on. Oh, we've got another polling question. Fancy that. What are the attributes of F10 barrier cream, with or without insecticide, which render it applicable to small mammal treatments? So, A, The ointment in F10 barrier cream is lanolin. In other words, it's the oil that you naturally find in sheep's wool. It's a natural, non-toxic product. It creates a good barrier to prevent continual wetting of tissue, e.g. Dacryocystitis, urinary or fecal incontinence or hypersalivation, whilst also controlling or preventing infectious pathogens without the need for systemic therapy. So that was A. B, F10 barrier ointment, it should be, causes irritation to inflamed tissue and so should be used with care. Or C, F10 barrier ointment causes stomatitis if ingested by the patient and should only ever be applied to wounds which the patient cannot reach. Or D, F10 barrier ointment, it should say, is only effective against gram-negative bacteria, and as most skin pathogens are gram-positive, its use is not recommended in this situation. Or E, F10 barrier ointment spreads through the animal's coat and is very challenging to remove by cleaning or even shampooing, and hence is not recommended to be applied to wounds surrounded by fur. So it does raise a few interesting questions, but I think probably by now you've gauged what Molly and I think about it.
So the polls are up and running. So we've got about 43 people that's voted already. Front
Molly,
runner, right?
you're allowed to vote too, Molly, you know.
Yeah, I was looking at that.
Please make sure you choose the right option. So 96% of our votes currently is for option number A.
Oh, good. Yeah, we got the numbers there now.
2% equal between C and B, and no votes for B or E.
Okay. So let's just touch on the C. F10 barrier ointment causes stomatitis if ingested by the patient. No, it doesn't. And D, F10 barrier ointment is only effective against gram-negative. No, it's not. It's very effective against gram-negative and gram-positive and fungal and viruses. So a lot of people got A. Well done, everybody. Okay, let's move on. Okay. Come on, Molly. This is your stuff here.
Yeah, ringworm. Yeah. So again, we see ringworm regularly across the board, from hamsters, as you can see here, through hedgehogs, African pygmy hedgehogs, wild hedgehogs, other species, certainly in guinea pigs, very, very regularly. And while theoretically it's self-limiting, again, many times the reason that these animals are starting to become clinical with ringworm is that there are other issues. There's husbandry issues, there are issues with its immune response, that type of thing. And therefore, we can find it very, very challenging to get cases resolved, and particularly with the fact that these, ringworm is also a zoonosis. It can affect the owners, and certainly particularly if there are any children in the environment. So we have an issue here. And again, it's useful to have a product whereby we can actually say, right, we can sort this out. It might not be a quick fix, but we can certainly sort the condition out and certainly work towards doing that. So obviously, we would definitely want to use F10 in the environment as well as directly potentially on the patient. So in terms of this, sometimes, again, with the handling, we can find this a little bit challenging, because if you've ever tried bathing a really, really upset hamster, you'll probably have the scars to prove it. However, it's certainly perfectly possible. And as Neil was saying before, in many ways, it's less of a strong-armed approach, trying to not have the animal be completely terrified, being gentle and empathetic with them in terms of this, and also being very careful with the water temperature, because you don't want to chill the animal, but you absolutely do not want it to become hypothermic either.
No.
So if you can, if you can physically do this, if you need to consider the use sometimes of a little bit of sedation, as long as you're extremely careful with that, and particularly extremely careful with heating and cooling in that situation, then, in terms of that, if you're able to do it, this works absolutely beautifully. And again, we often will use F10 products in combination with something else if that animal needs something perhaps a little bit systemic because we've got something else going on. But again, it's a comprehensive way of dealing with it, because you actually bring together the use of several of the F10 products to get the ultimate goal of the resolution of the ringworm.
Sure.
You know?
Sure. I'm interested. I'd just like to pick your brains on it, because you mentioned perhaps using a little bit of sedative. One reservation I have about sedatives is that I don't want to send an animal home that is still sedated. And in fact, you know, we traditionally always used midazolam and buprenorphine for pre-medication in little people like guinea pigs and so on. And I found that actually we improved our peri-surgical anesthesia survival rate dramatically by reversing the midazolam with flumethanil afterwards. I found that really, really useful. But the thing I wanted to raise, so I say I have a little bit of a hesitation about sedation, but by perhaps I reach for the isoflurane or the sevoflurane with mammals more readily, because I think the point is that getting a really good wash is absolutely vital. You know, and like you, I want to have that bowl of fluid that, you know, so basically I'm going to lather up as best I can, but I tend to use a fairly small round bowl and have the temperature exactly right. So just slightly warmer than body temperature so that it's comfortable for the patient. But I want to actually soak the patient in there, and I want to leave that F10 on for 15 minutes without the animal chilling. So you've got to be quite careful, but I personally would use either Sevo or ISO to get it completely wet and then wake it up, and I would wrap it. I would either have bubble wrap or exposure blanket around it so it didn't chill whilst it was still wet, and then dried it off afterwards. And of course, we all know drying off, being very if you are going to use a hairdryer, be very careful not to blow hot air at the eyes. And I absolutely.
The ears, actually.
Sorry?
Or the ear tips, actually.
Yes.
So some of these little guys will certainly get heat necrosis of the exposed ear tips if you're not really, really careful.
Yeah. Good point. But but I loved your point, and absolutely so important that you don't just treat the patient. You know, at the time you get the patient down to shampoo it, you actually clean out the accommodation and give it a really good blasting with F10 as well, because otherwise you're back to where you came from. And it's interesting. Health and Hygiene's recommendation is just to shampoo the patient every second day for 3 treatments, or until symptoms are clear, which is absolutely appropriate and fine. But I think, you know, all of us in practice will appreciate that sometimes it goes on for longer, but particularly where the owner's doing it at home, they've got a lot of animals, and actually the basic hygiene. So, you know, shampooing the animals, yes, but they're not doing the hygiene of the cages properly. But an interesting, challenging problem often. Okay, let's go on. What about respiratory disease, Molly?
Oh yeah, so I think this is one where Neil and I have already discussed this, and I think we're very much on the same page. We see a lot of respiratory disease in rabbits and rodents, and they present us with several challenges. You know, it isn't as simple as just give them some antibiotics and they get better. And in many cases, unless we really look at the beginning at trying to do everything that we can to improve things sort of quite early in the course of the disease, we can end up with animals that are very chronically unwell and actually have physical, almost irreparable damage or scarring within their respiratory tract.
Absolutely. Yeah.
So it is certainly difficult. And as the slide says, in terms of body size, most of these guys have relatively smaller lungs than are carnivorous mammals, so the cats and the dogs in particular. And especially with those species where there are no septal divisions, then the spread of pneumonia, you know, as soon as those lungs get diseased, it spreads and it isn't localized and it does compromise respiration. And because the lungs are already small and many of these guys are already immunosuppressed and stressed, then we have animals that become very, very precarious. So we need to kind of think about throwing everything that we can at this animal. And I said before, and I'll probably say several more times, we have to do something that makes these animals feel better. So antibiotics will treat bacterial pneumonia, but if you had bacterial pneumonia, you would definitely want the improved air quality, you would want the mucolytics, you would want the non-steroidal anti-inflammatory drugs or the pain relief, and potentially the nebulization, as well as part of a comprehensive treatment package. And I definitely get these guys on antibiotics, obviously and absolutely, but I also do hammer the mucolytics. And actually, one of the questions I was going to ask Neil when he was talking about the yeast conjunctivitis is, I'm old enough now to remember making eye drops with acetylcysteine for very severe ulceration, because there's a lot of mucoid discharge in there. And I wondered actually whether, in these sorts of cases, the application of that with the F10 might be really useful.
Yeah,
certainly
it's something that I've often done, and like you, Molly, I think the crucial thing is you hit these little guys hard right from the start. You don't just mess around trying a little bit of Baytril and come back if it's no better. You hit it hard, and so you'll see on the slide here two of my important things are air quality. So if you're feeding hay, then just as you would a horse with COPD, you would actually soak the hay for 12 hours. So you put it in an onion bag and put it in a basin with a weight on top of it for 12 hours. I also talk to clients, because a lot of these are rats and things like that. I talk to clients about stress. Is the child messing around with them? Does the cat sit on top of their cage? All these sorts of things are important. But going back to the mucolytics, yes, mucolytics, absolutely. Acetylcysteine but using nebulization with F10 from the start is an absolutely crucial part of it for me, because very often these are multifactorial etiologies. So you've got mycoplasmas, you've probably got viruses, and you've got bacteria. Now, it doesn't matter what antibiotic you throw at them, you're not going to solve all of those. But you use F10, you will certainly reduce that in contagious infection load significantly, at the same time improving the nutrition, the husbandry, and all the rest of it. So I think it's really important. And certainly in the UK, we don't actually stock nebulizers ourselves in the clinic. No. But we have a web link to the company that we recommend that you get them from, and people can get them delivered the next day for £85, which you may sounds like a lot of money, but in terms of the overall cost of treating that patient, okay, you're more than doubling the cost, but actually it's a piece of equipment they can use long term. And a lot of owners, they're so committed, they really want to do their best. And if you explain to them that if we don't get it right now, as Molly said, if 2-3 weeks down the line we still haven't resolved that pneumonia, actually that animal is going to have chronic disease for the rest of its days and probably have a shortened life. So really important to do the whole hog.
Yeah. And one of the things we find actually that's very useful is we've done the antibiotics, we've got clinical resolution, but we have an owner who knows what the signs are like, who has a nebulizer. And actually, if we do end up getting flare-ups, I'm perfectly happy for them to either nebulize regularly and just keep things under control, and particularly in rats where there will be underlying scarring and there will be an underlying hypersecretion of mucus in the lungs. If you're looking at mycoplasma, then those guys can have periodic nebulization,
absolutely.
saline and F10.
Absolutely.
And the owners just rock on and do that until we can get them in if we need to see them.
And the nice thing is it's good medicine, but actually it also gives the owner something they can do that they know is good for their patient. They feel happy about that. So as you said, the nebulizer's there. The F10 is super safe and will just keep the levels of mycoplasma and other pathogens down so that the patient can control it. So no, it's a super thing to do.
Yeah.
Right.
Absolutely.
Oh, another polling question. So which statement is most accurate in respect of the use of F10 products in small mammals with respiratory disease? F10 SC 1 in 250 in saline can be used to treat respiratory disease in any species by placing the patient in a room with a fogging machine which delivers the F10 fog. Answer B. If F10 is applied by fogging or nebulization, the area should be well ventilated for 30 minutes before staff re-enter the room in case they have an adverse reaction to the F10. C. F10 SC 1 in 250 in saline should be applied by nebulization, generating a particle size of 0.5 to 2 mu so that the particles are carried as far into the respiratory system as possible. Nebulization should be conducted 3 times a day for 30 minutes, typically for a 5 to 10 day period. Or D. F10 SC 1 in 250 in saline should be applied by nebulization, generating a particle size of 2 to 5 mu, so that particles are carried as far into the respiratory system as possible. Nebulization should be conducted 3 times a day for 30 minutes, typically for 5 to 10 days. Or E, F10 SC 1 in 250 in water should be applied by nebulization, generating a particle size of 0.5 to 2 mu, so that the particles are carried as far into the respiratory system as possible. Nebulization should be conducted 3 times a day for 30 minutes, typically for 5 to 10 days. Okay, so vote away. You may think that some of those look very similar. And in fact, it looks to me as though D and E are completely similar. So
it's just the particle size that change.
Yeah, you're absolutely right. Okay, so we've got two different particle sizes there. We've got fogging or nebulization, or we've got nebulization. So I know that the answer to this is a little bit technical, and we haven't told you the answer, so we are going to forgive you all if you get it wrong. But it's all part of learning, you see.
So luckily the polls are anonymous, so nobody will be judged. So we currently have 60% of our votes for option number C. Then we've got 22% for D and 14% for option A.
Okay.
So we've got about 40 votes. I think people are scratching their heads on this one a little bit.
Yes, just to point it out, the other difference between D and E, D said F10 SC in saline with a particle size of 2 to 5 mu, whereas E said F10 SC in water with a particle size of 0.5 to 2 mu.
So E has just come into the run-in with about 9% of our members saying E. We've got 0 votes for B, so nobody chose the second option. So it looks like it is now sort of taming down.
Okay. Well, that's good, guys. And answer C is the correct answer, because basically we do want a particle size of 0.5 to 2 mu, and we do want it put in saline rather than in water, and 3 times a day for 30 minutes is perfect. Right, okay, on we go. Let's see what else we can find to talk about. Okay, so Bulla Osteotomy, is this something you like doing, Molly?
No, I hate it. I think these are challenging. So I think we've had this discussion before. These are challenging and quite invasive.
Yeah.
And, we've shared techniques and tips for this. And one of the things that, Neil and I have discussed previously is the fact that, you have some Bulla osteotomies that do absolutely beautifully afterwards, and some of them where we have longer problems. And so I'm certainly a little bit reticent these days to just close the wound and hope the infection is under control. So, if I do it, if our boarded surgeon does it, we still sometimes have to do revision surgery. And so flushing the cavity with F10, absolutely. And if I can get a big enough stoma, I've talked a little bit, and we'll talk further in a minute about abscesses. If I can get a big enough stoma, then I use a product that we have here called an earwick, which is essentially a piece of sterile cotton padding that I can stitch in to the tympanic bulla if I can physically, the rabbit size is appropriate, if I can physically get it in there. And again, that means that I can soak that with F10, and because it's cotton, I can keep soaking it with F10 over the next 4 or 5 days to keep the product in contact. And because it's not ototoxic, we don't have any issues with that. So, I mean, that's the way that I will try and use it. And again, it's fairly similar to what I do with some of the difficult abscesses. But sure. I like the idea of, putting in the barrier ointment as well, because one of the issues that we have post-op with this, again, is the fact that, there's discharge, there might be pus coming out, and the skin around that incision can get very sore indeed. So we find it useful in several ways with these sorts of cases.
Sure. That's great. So, I mean, just for those who are less familiar with this particular case, it's a very, very common condition in rabbits. Something like, well, you tell me, Molly, you're the specialist. What percentage of clinically normal rabbits have otitis media?
I think it's the guys at the University of Edinburgh are looking at this, and I think it's getting towards 30%-ish now. There's a lot of rabbits that might even have bilateral disease without showing any signs at all.
Sure.
And when it becomes otitis interna, then we get the head tilt. But it doesn't mean there is pressure and deafness and that kind of thing.
Sure. So the point here is that, yes, it's very, very common. The figure I had in my mind was 35%, which one publication that I'd read many years ago, but it's thereabouts. And a lot of these cases are actually aclinical. There is no clinical presentation that they've got the problem there in the first place. And the diagnosis is difficult for the reason you explained, Molly, that actually very many cases are affected on both sides. So whereas if a cat or a dog, you x-ray it and you have a black bulla and a white bulla, and the white one's full of pus. Whereas with rabbits, if they're both grey, what does that mean? Have they both got it, or has neither of them got it? And that's why CT becomes such an excellent way to make the diagnosis. But the real crux of it, as you've indicated, is actually controlling the infection in the bulla. So yes, we can do the surgery, we can access it. And it's interesting because I looked at this situation probably 15 years ago, and I went to 2 different conferences. One from one of the clinicians at Edinburgh University who said, absolutely, scrape it out well, clean it up and close it. And I went to another one in Europe by an excellent European diploma holder from an Eastern European country who said, always leave it open and let it drain. And there you go. 2 people who are both diplomats with totally different approaches. And I'm with you, Molly. I if I possibly can, I would always leave it open and let it granulate. And the earwick is a lovely situation. Sometimes in the past, I've used gauze swabs in bigger rabbits, gauze swabs soaked in F10, and then I take out a centimeter or what each day. So you're gradually taking it out, but you're leaving the F10 in contact with there, and you can always dribble more F10 in there, and you're letting it granulate from behind. F10, I think, is lovely, and I've certainly used that, putting that, yes, obviously, taking a swab from the bulla before you put any F10 in there, I think is really important. So you've got a culture sensitivity, you know what you're going to be treating, but then cleaning the bulla out really, really well, and then doing something, and I think we all know the underlying cause of treatment failures is going to be residual infection that hasn't been controlled. So having a broad-acting, safe product that you can put in there, whether that's in a soaked swab, a earwick, or using the ointment, whichever way that works, And I know there are some academic people who might suggest that using an ointment delays healing. Well, you know what? Actually, in this situation, I want to delay healing. So I don't actually believe it's that big an issue anyway. But if it does delay healing by a day or two, for me, that's a positive thing, because for me, the problems arise when it heals too quickly. You know, we need to get that infection controlled before it's closed, so that we can keep treating it and keep the infection controlled. But it's one of those interesting topics, because everyone has a slightly different approach to it. But I think everyone has to agree it's residual infection with very often a multi-antibiotic resistant organism, which is often the problem.
Yeah, absolutely.
Okay, so Otitis Externa.
Yeah. Again, so I liked this idea, and I like the fact that you suggest that, you know, putting the F10 barrier ointment will just sort of liquefy and drain over a few days. I think that's brilliant.
It's funny, when someone first mentioned it to me, I thought, "Ooh, that's going to block the ear canal. It's going to stop the airflow and stop the drying." And then I stopped and thought about it. You know, lanolin on sheep does not set solid, because they're a warm patient. And of course, as soon as you put ointment into a patient like this, it does liquefy and it comes out. So it actually, but it doesn't come out too quickly. You know, a lot of ear drops, and particularly watery ear drops, will be in and out in a matter of hours, whereas the barrier ointment is actually going to be around there for probably 3, 4, 5 days. And for me, it works really, really well in that situation.
Yeah, I've just recently used it on a very difficult case of a rabbit with ear mites. So rabbit is about 9 months old, and he has and is hopefully recovering from my first ever case of truly confirmed clinical toxoplasma.
Oh, wow.
And it has made it very difficult for him to groom his ears. And at the beginning of all of this, he certainly started off with ear mites. And I saw him back recently with very, very sore ears with ear mites. And we started F10 treatment because he's very, very sensitive to ivermectins now. And the F10, actually, while it's not necessarily authorized for use in ear mites, is working beautifully, because it's sitting in there. It's not bothering him. It doesn't hurt. He's not reactive to it. We're not trying to clean the crusts or anything off.
Sure.
And it's doing him the world of good, actually. Definitely.
Good. Fantastic.
It's one of those things. It's one of those things that I've learned from sort of talking to you about this and going through this webinar.
Great. And you know, and yet you see, as a starting point, people wouldn't naturally think about F10 barrier ointment as a treatment for ear mites as such. But you're right. You get that crusting, and if you take the crust off, it's so sore and inflamed underneath, and yet actually the ointment just soothes it all. It liquefies the crust. And it's a win-win. Very nice.
It absolutely is.
Yeah. Super. Okay. So, Dacryocystitis in rabbits.
Do you
want to tell us about your findings here?
Yeah. No. Again, so this is one of the common ways that I will use F10 in rabbits. And I think we see Dacryocystitis very, very commonly. And the glands get infected, the tear ducts get blocked. And what we shouldn't forget is how damaged and how painful the skin under the eyes will often be. So I typically will use a dilute F10. So it might be 1 in 250, it might be 1 in 500. Because I'm sort of a little bit conscious of the fact that sometimes when you're trying to flush tear ducts, the duct will rupture. So you can get sort of saline and what have you in the retrobulbar space. This is absolutely a case in point where I will add a little bit of something that will break down the mucus into my saline as well.
Sure.
So for this, it allows me to clear the duct. It allows the duct to be lined with something that is likely to be able to, deal with what's in there, and it gets rid of the debris as well. And, you can see here, we're likely to be potentially having a dental issue there. But for me, the bigger welfare issue, we all recognize the dental part. We deal with that. We understand that bit. But these rabbits with the chronic tear duct blockage, and the severe epiphora, that skin is incredibly painful. And at this time of year, it is absolutely a case in point where it's likely to cause Flystrike. And so in these cases, I actually use the F10 barrier ointment with the insecticide very carefully. And I have a lot of bright pink faces on rabbits, but it gives myself and the owners some kind of security that we're not going to get Flystrike on this damaged, painful skin. And as I've said before, actually you put the ointment on and there's a barrier and that skin condition improves. Still needs analgesia quite often, but it significantly improves.
And the thing the thing I also love about this, and pointed out on the slide here, is that remembering that only 65% of Pastorella species are sensitive to either Enroflox or trimethoprim. And you think about it, 95% of antibiotics given out to pet rabbits in veterinary clinics are either Enroflox or trimethoprim. And so, it's one of these situations where actually, if it is recurrent, a lot of the problem might be an antibiotic resistant strain of Pastorella. And so, I would always encourage people to do a culture sensitivity and see if they do need to be using a different antibiotic. But I think, certainly my experience of using F10 where you have a resistant organism, and I'm not pretending it will solve the whole problem, but actually many times I've used it and then found the antibiotic that was supposed to be resistant, the bug was supposed to be resistant to, actually was then effective against it, because we just actually reduced the contagion load enough, the pathogen load enough.
Fabulous.
Interesting. Okay, so then of course that does have to take us to the Flystrike question.
Absolutely. And I think it's worthwhile saying that Flystrike doesn't occur in normal skin. It occurs in wet, damaged skin. So urinary incontinence, diarrhea, failure to eat cicatrose, epiphora, open abscesses, all of those sort of conditions, all of which we can then be looking at trying to improve by using this kind of a product. And, so I think, again, it's not simply the germicidal wound spray with insecticide. It might well be the clipping and cleaning and the use of the barrier cream. It might well be, flushing abscess cavities. And I've mentioned what I do with the tympanic bulla. If I have a very open marsupialized abscess cavity, I will often initially I'll pack it with a dressing that's sutured in, that's soaked with the F10 SC, and then as we progress to the wound healing, we'll use the ointment and pack that into the wound afterwards. And if we need to, if this rabbit is an outdoor rabbit, we'll use the insecticide as well. Either the ointment or the spray. So just again, it's where the combination works.
Thank you very much. That's great. Just to reiterate, though, the sort of very basic bit, which is easy for us to sort of skimp over, that obviously if you're using one of the residual Flystrike products, where one application lasts for 10 weeks, we have to remember that, of course, those products are water soluble. And if your rabbit is a rabbit with urinary or fecal incontinence, or even just a hypersalivation like this rabbit here, that actually as soon as you wash the rabbit, you're washing that depot skin treatment off. So it's not going to work. And that's where, as an alternative, you can use the F10 germicidal spray with insecticide, putting it on a once a week basis. But what I do want to really, really stress, a lot of vets and nurses and owners are used to putting on these residual Flystrike products where basically you put the rabbit on the table and you wet the back third of the rabbit above table surface level. If you're using F10 to do the same thing, it is 2 pumps per rabbit and not exceeding more than 1 pump per kilogram body weight. It's really important, because if you wet the back end of the rabbit as you would with these other products, there is the potential to cause toxic effects. So I don't want to scare people or make you think not to use it. It's a fantastically good product to use. And of course, if you do have a Flystrike case, you don't have to pick the maggots out. You just use the pump spray. But please do be careful. 2 pumps per rabbit, not exceeding 1 pump per kilogram body weight. But fantastically useful for rabbits that need a regular weekly bath. Okay, so I think that one actually then takes us on to a Flystrike case. So how do you approach your actual clinical cases? As you walk into the reception area and you know it's got Flystrike before you've even seen the rabbit. You can smell it. Horrible.
You can definitely smell it.
Yeah.
So I think there are always the two-pronged approach, which is dealing with the patient in front of you. So as you've quite rightly said, they are usually toxic. This can be rapidly fatal. So we do get these rabbits in, we do get them onto IV fluids very often. We do something to kill the maggots. And again, we do tend to use the wound spray for this. However, we also will give pain relief. And if you look at the kind of skin deficit in these pictures, you can appreciate that is significantly painful. So there's that approach with, aggressive antibiotics, aggressive fluid therapy, dealing with the animal at hand. But the second part of the approach, and the only way that you're going to get really good resolution, is trying to find out what has gone wrong and why this animal is now suddenly presenting with maggots. And in some cases, you already know. Some cases, you know that it has chronic issues with bladder sludging, or chronic mobility issues, meaning that it can't urinate in a proper posture, or it can't eat its cicatrose, and therefore we're going to have slightly wet, slightly potentially smelly and damaged skin. But that is an important part of the whole animal at this point. And as I say, we need to work very hard to get them through the first 3 or 4 days, and that tends to me to be the flashpoint in terms of where we're likely to get problems.
Sure.
And once we start to get, recovery happening, then again, these are cases where we will quite often use the barrier cream, get the skin health improved, as well as sort of actively looking for whatever has gone on and whatever has caused this.
Great, thank you very much indeed. But I think, and for me, the point I always make to all clinicians is, for heaven's sake, the risk period in your local area. For us in the UK, 1st of May to the 1st of October. It's very straightforward. We know when it is, and every veterinary facility that is potentially going to see a rabbit, and I would also say guinea pigs. We certainly in recent years we've seen more guinea pigs with Flystrike than rabbits, just simply because most people are using prevention on their rabbits. But the thing is, when you need it, it will be an emergency, and it is the only product licensed for the treatment of Flystrike. There are some others that are licensed for prevention, but remember, the avermectin products actually you can't use once the animal has got Flystrike. They're not effective. So you must have a bottle on the shelf, or several. Okay, on we go then. Just a little note here, that do just remember that cypermethrin is not registered for use in domestic cats. Cats are particularly sensitive to the toxic effects of cypermethrins, so never apply it to a cat. And even if you're applying it to a rabbit, do just check with the owner that this isn't a rabbit that lives with a cat and they spend all day nuzzling each other. We do want to make sure that none of it gets onto the cat. So do please be careful. Any F10 product with insecticide mustn't be used in a cat. Okay, so we have another polling question. Which statement is most accurate in respect of F10 germicidal spray with insecticide? A, F10 germicidal spray with insecticide is safe for use on all mammals and should be applied liberally to the coat once a week. Or B, germicidal spray with insecticide, as with all medications, must be used with care in accordance with the manufacturer's recommendations. It should not be used in cats, and the application rate is 1 pump per kilo body weight once a week. Or C, F10 germicidal spray with insecticide, as with all medications, must be used with care in accordance with the manufacturer's recommendations. It should not be used in cats. In rabbits, the rear half of the rabbit should be dampened with the spray once a week during the rest season. Or D, this spray is designed for use on solid surfaces and should never be applied to a patient's skin. Or E, the spray should be applied to the skin, 1 pump per kilogram body weight, every 3 days or as often as the coat is washed. So off you go, guys. I'm going to have my vote.
So the votes are coming in slow and steady. Got about 27 votes so far. The most popular option so far is option number B. About 74% of our audience choosing B. Our next option would be C, 17% of the votes. No votes for A, no votes for D at this stage.
Okay, so let's just talk through that. So looking at B, that's so spray with insecticides, as with all medications, must be used with care in accordance with the manufacturer's recommendations. That's good advice. It should not be used in cats. That's important. And the application rate is 1 pump per kilogram body weight once a week. That is correct. So B is a good answer.
Perfect.
C,
77%, yes.
Yeah, 78 now. C is not correct because what it says in rabbits, the rear half of the rabbit should be dampened. And if you remember what we said is if you dampen the rear half, you're giving too much. You're going to overdose it. So C is not correct for that reason. And E, the spray should be applied to the skin 1 pump per kilogram body weight every 3 days or as often as the coat is washed. Once a week is really what is recommended. So there we are. Everyone did well. Pat yourself on the back again. Okay, so on we go. Now, Molly, I know sore hocks is one of your, I was going to say bête noires, but it's also it's a challenge. It's a challenge, but you have your tricks.
Yes, again, I mean, we see sore hocks in guinea pigs, chinchillas, rabbits, again, very regularly. And it's a combination of etiologies as we've put here. So substrate being poor, whatever's underfoot, but very much reduced mobility. So whether that is osteoarthritis, for example, or failure to balance or something like that, or because these animals are kept in very tiny confined spaces, or because they think that they don't want to be outside with the cat or the child. You know, all of those things can lead to them not moving normally and not moving enough, and the development of decubitus or pressure sores. And these are painful and they are hard, you know, they're hard to get right. And, you know, as we've mentioned here, actually those guinea pigs are not being fed correctly and they're having issues with the mobility due to hypovitaminosis C. Yeah, all of those things. So as part of a multimodal treatment, we absolutely, particularly in the infected sores, will use the F10 barrier ointment, as well as padded dressings, as well as, you know, pain relief, as well as husbandry and environmental advice. But again, the story is always, it's part of a multimodal, and it's probably quite aggressive is the wrong word, but quite a keen approach to these cases quite early on.
Yeah. Good. Thank you very much. And I think also, my view would be that sore hocks is probably an underdiagnosed condition. And I wonder how many clinicians actually make the point of checking the hocks every time, either visually or just with your hand, just having a feel, are they fur covered and comfortable or not. But I think it's something that, you know, we must encourage people to check. Aha!
It's common.
Yeah, well, yeah, there are owners who have said that to me. I've given them a quick slap, of course. So can I talk about this one, Molly? Because this is one of my areas where I think it's really important that people think about the use of F10SC in saline, typically, in situations where you've got these multi-resistant pathogens. And cystitis is one of the top on the list. Otitis would be another. And I know you're going to talk about abscesses and infected joints and things in a minute. Sinusitis would be another one. Could be a rabbit with molar teeth erupting into the sinuses. But the point is that, and let's take the cystitis case. And the way I've managed these is I've actually put an indwelling catheter in, and I've allowed the rabbit to go home and got the owner actually flushing the bladder on a daily basis or twice daily basis with F10 and SC. So I mix up a bag of saline, put a bit of F10 in a bag of saline to give my 1 in 250 concentration, and got the owners to be washing it, and done that for usually 4 or 5 days. That's all. Obviously done culture, maintain systemic antibiotics as well. But again, as I said before, using F10 to reduce the burden, the pathogen burden load, to then enable the antibiotic to finish the job off. It may be F10 would finish it off as well. I'm not saying it wouldn't, but using the two together, I've found has solved problems where the antibiotic alone certainly could not. So I just want to introduce, we know that it doesn't damage mucosal surfaces. Therefore, it's not going to damage the inside of a bladder. We know if we got a recurrent cystitis, it's going to be sore and inflamed anyway. We know that's not a problem, but actually is a jolly good solution. So I think, and I'm going to let you go on to joints and abscesses in a minute, but I think there's an awful lot of situations where you've got a nasty infection that you can't resolve with conventional antibiotic therapy, where combining it with some way of getting F10 in contact with that surface and maintaining it in contact gives you a much better recovery rate. Agreed?
Absolutely.
Yeah,
definitely.
So that takes us on to managing septic and contaminated spaces.
Yeah, absolutely. So obviously, Health and Hygiene hasn't conducted the safety testing for irrigation of these septic spaces. So at that point, we can't actively recommend that. So septic joints, for example, tooth roots, peritoneum, to take examples. But to share our experience, and my experience with this is that I've certainly used F10 in infected joints. And, at some point, if I am the last resort and we have an animal that either might lose its leg or might be euthanized, then I'm very willing, with the owner's participation and consent, to say, right, let's try this. And so what I've done with infected joints is, in a little kind of extension to what I've talked about with tympanic bully and abscesses, is I use a foam wound dressing, and that foam wound dressing is flexible, it's soft, it's sterile, it's absorbent, and I can soak it in F10, and I can stitch that into the joint cavity, and that joint can still move without discomfort. And we don't leave it in there for very long. However, we can leave it in there for 24 or 48 hours, and that actually works beautifully. And there are actually proprietary products with other antibiotics that do the same thing. And I just thought, this will work. And I've got to say that, we talked a little bit about methyl methacrylate beads the other day for use in abscess cavities, with some of these very resistant infections. And at the moment, I haven't figured out a way to use F10 in these beads. However, I do think that we might be able to use F10 in plaster of Paris beads. And the advantage with that is that we could get those into abscess cavities. Plaster of Paris is actually biodegradable. So unlike methyl methacrylate, we wouldn't need to take it out. So what that would then give us is F10 that is, directly in contact with an infected area or surface. So I think it's a case of watch this space. I'm going to, that this is something that is seriously a consideration. I can, can produce that relatively easily. Yeah. But the thing is that this is anecdotal. This is people's experience rather than evidence-based as yet. However, we will get the evidence base.
Sure, sure. So taking that a little bit further from some of my experiences, the other product that I've used in a very, very similar way will be one of the alginate wound dressings. So a seaweed-based absorbable material. So, it can actually be left somewhere and it's going to get absorbed. But I've actually commonly used these in things like dental sulcuses. After I've moved a nasty manky tooth, I will actually put an alginate dressing in the knowledge that it's going to control bleeding, but actually I've soaked it in F10 first, or I've even put a little squirt of F10 barrier ointment up the hole first and then put the alginate dressing in. Again, it's all going to drain out, so it's not going to cause any problem at all, but it will give us some really nice long-acting antibacterial effect there, so that's great. But also to go on to the peritoneums, and I'm not saying that you would rush in and flush out every healthy peritoneum with F10, but I have had those septic peritoneums where I've used saline with F10. I've warm saline, obviously, so we don't shock the patient. I've filled the abdomen with warm saline with F10, whooshed it all around, shaken it about a bit, left it in there 5 minutes or so if I can, and then tended to flush it out probably 3 or 4 times with more warm saline afterwards. And, I'm not going to tell you every one of those survived, but you know what? If I hadn't used that, I think none of them would have survived. And I've really been very pleasantly surprised. Not just mammals, but reptiles as well. A little bit more care with birds because of the air sacs. But I think, septic foci, septic peritoneums, nasty abscesses, all these situations actually are a great situation in which to use an F10. You've just got to think laterally a bit as to how can you get it to remain in contact with the tissue for long enough to give that longer acting effect. But yeah, it's safe, it's good, it doesn't cause inflammation, and it controls pathogens. So I'm happy. Okay, so as we said before, I think Molly and I both stress that typically F10 products are used as an integral and vital part of a multimodal approach, always including other medications such as analgesia, systemic antibiotics, improved nutrition, improved husbandry, and improved management. But it's a key part of it. And I think both of us would say, hand on heart, if we were suddenly without F10, we would be worrying what on earth we're going to do and how we're going to cope without it, because it really is to us an essential part of it. So what about the evidence for safety and efficacy of F10? Well, as I said before, F10 is licensed not only as a safe and effective veterinary disinfectant, but also as a safe and effective treatment product. And that's not just licensed in the UK, in Europe. I'll give you a list in a moment of the distributors across the world, but many parts in the Far East now, in the Middle East, and of course it's been licensed for use under the MUM scheme. And in fact, some people may think health and hygiene is a bit sort of foot in the mud, but health and hygiene F10 products were only the second only product to be accepted by the FDA under the MUM scheme for minor species in America. And I was co-chair of the committee that assessed the efficacy and safety together with David Guzman. And very, very interesting project to go through. So it's approved for use in America, and they require it to be safe, but also, of course, effective. But they also have stringent environmental tests that it has to comply with, which, of course, it did without any problem at all. It's not just a flash in a pan. This is a product that's been around for 20 years and has been widely used, and there's a lot of literature to say just how and why it's been good to use. So, key choice points for F10: safety. safety, safety to patient and user, tested on end products by accredited external quality control laboratories. Efficacy, tested by independent accredited controlled laboratories. Environmental safety, tested by accredited quality controlled laboratories. And of course, one of the big key points is the lack of metal corrosion. And that's pretty unique amongst disinfectants. And it means that we can use fogging, and that means we can get the products inhaled, and we can use it by nebulization. There isn't another licensed disinfectant product that we can do that with, which has the range of efficacy that F10 does. So again, key points about F10. It's produced by Health and Hygiene, which is an ethical, evidence-based quality manufacturer. It has added value to all the products by education, by training, by provision of application instructions, safety, and efficacy certification. And unlike other manufacturers, all those safety and efficacy certificates are available for you on the website. Treatment products are a great way to encourage veterinary surgeons to use F10 products. And then, of course, once they realize how good they are, then they probably use them for some of their biosecurity and cleaning as well. So there we are. That really covers sort of F10. And just to sort of touch on that, apart from disinfectants and antiseptics, another thing, and I was inspecting a zoo a couple of weeks ago, and there was a young lady working really hard with a mop, scrubbing out the floor, but the floor was brown and greasy and dirty because no one had used a degreaser on it. Remember, the lipid surface layer is what traps the pathogens. And when you do your deep cleans, and obviously you deep clean proportionate to the risk of contamination in each different area in the hospital, when you do the deep clean, you must use the degreaser. So that's the F10 919 degreaser that does that. So, polling question: which statement is most correct in respect of creation of a biosecurity control process? A, F10 is such a wonderful, safe and effective disinfectant that simply applying F10 at all stages of admission, treatment and discharge will control any risks. Or B, biosecurity control should involve a structured, written process which all staff members adhere to in order to minimize the introduction of pathogens, manage the management of staff, animals, and fomites to minimize the spread, and the effective cleaning and disinfection and monitoring of outcomes. Or C, the correct choice of disinfectant to use within a biosecurity process is essential. This is best decided based on cost, color, scent, and how much you like the representative. Or D, biosecurity is overrated in these days of antimicrobials, antiviral, antibiotic, antifungal agents. They can be used to control patient infections that might arise. Or lastly, E, when choosing an effective disinfectant, you can rely on the data and information provided to you by the sales representative. It just makes me cross because I'm telling you the answer now, but some of what you get told is a load of baloney. So, have your vote, folks.
The votes are open. We're standing about 50.
Wow, gosh, everyone's still awake and they're doing ever so well. And yes, you might like to think that F10 is so wonderfully safe and effective disinfectant that just chucking it all over the place will solve all your problems. But that's not the point of a proper biosecurity process. So B is a really good answer. Biosecurity control should involve a structured, written process which all staff members from T-boy to clinical director and owner adhere to in order to minimize the introduction of pathogens, the management of staff, animals, and fomites to minimize the spread, effective cleaning and disinfection, and the monitoring of outcomes. Absolutely. So, yeah, it's great. I just thought, I have to say, and it sounds awful, someone saying that something good has come of COVID. But I have to say one good thing that has come is that veterinary clinicians have paid more attention to biosecurity and managing contamination in their facilities. So thank you, COVID, for that, but I still wish you hadn't come. So here we have a list of distributors. So we've got America there, and I can just say, so America, there's 2 companies who distribute. There's Pure Clean Bio LLC, and that's Dr. Elliot Garber and Emmy Neffo. And they will be at the ExoticsCon conference. So if any of our American colleagues, I know some of our American colleagues are watching, do go along and have a chat with Elliot or Emily or Emmy. So that's there. And also there's Viva Pet Supplies with Nishad Patel over in America. UK, we've got Meadows Animal Health, UAE, Eurovets, Veterinary Supplies, Qatar, Al Galail, Equine Center, Singapore, Indonesia, Malaysia, and Thailand, All Health Solutions, PTE, Hong Kong, The Parrot Shop, Australia, New Zealand, Chemical Essentials, and Iraq, Al Mahuna Vet Supplies. That makes it look as though Europe is not supplied, but there are suppliers throughout Europe as well. So it just really wanting to make the point that this isn't just a little product made in South Africa that some people have talked about. This is a global disinfectant. And in many of these areas, it is actually the leading veterinary disinfectant that is available. So, yeah, if you're in America, do go along to ExoticsCon. It's a fantastic conference, really, really good teaching opportunity, learning opportunity. But do drop by and have a chat with Elliot or Emmy at the Pure Clean Bio stand. So having said all of that, I want to thank Molly especially. It's been a real pleasure. It's always lovely doing these things with Molly. And I think, this is one of the great things is actually people being honest and sharing their own experiences and what's worked for them and so on. Really, really useful. So thank you, Molly, so much, because, you could read a dozen textbooks and you wouldn't have learned what you've shared with everyone tonight. So thank you very much indeed.
Well, thank you, and it's been an honor. It really has been an honor. So, yeah, I appreciate it.
Well, thank you. Also like to thank Cornet and the SAVET-Con event management team, and of course F10 Products YouTube. Do have a look on there. The previous webinars we did are on there, so that's some good stuff. And just a note for your diaries: don't miss Tuesday, the 7th of September. And we've got a discussion on the use of F10 products for the treatment of zoo animals. So that's going to be a really good one there. Looking forward to that. So make a note in your diary. And as ever, we've got the references there. I'm not going to go through all of that. But if people have got any questions, we're very happy to address any questions now.
There's a couple of questions, absolutely. Neil. If you click on the questions tab, you can have a look at them. I can assist as well.
Okay, so we've got Vilin Song saying, what hay treatment method would you recommend to minimize dust? Certainly what from the point of view of horses, works in horses, it'll work in rabbits. Put the hay in a net bag and soak the hay underwater for a 12-hour period. Nice and easy. Which other fungi are commonly involved in dermatomycosis cases? Well, that's nice and straightforward. Well, come on then, Molly. You tell.
Well, is it? I think we talked about dermatophytosis. We didn't talk about directly fungal skin disease. And so in the UK, I would say, other than ringworm, which would be sort of trichophyton or microsporum, we don't tend to get, the fungal skin diseases that you might get in hotter areas, if you like. So typically we'd see trichophyton, mantagrophytes, and microsporum canis and other species as the very typical fungal ones.
I suppose actually thinking about small mammals in hot climates, if you had a chinchilla or a guinea pig in Hong Kong or Singapore, then actually in that sort of warm, humid environment, using F10 shampoo once a week to control fungal infection as a preventive thing, just to keep the levels low, I think that would work pretty well as well.
Yeah, it'd be very useful.
but you say in the UK we don't have that problem, but I think in some areas of the world that would be good.
Yeah, absolutely.
Okay, will the use of germicidal treatment shampoo be effective in use on dogs and cats? Well, what I have to point out is that in most areas, the F10 treatment products are licensed for minor species. And that, of course they work in cats and dogs, but they're in many where they are licensed to be used for cats and dogs, yes, carry on and use them. They'll work extremely well. But I can't advise you to use them in regional areas where they're not actually licensed. And then Vilin Song is asking again, when using a 1 in 500 solution for ocular administration, would you recommend certain storage, e.g. refrigeration, shelf life, such that it does not become contaminated, or is that not a significant issue? Well, of course, F10SC is a very effective antibacterial, antifungal, antiviral agent. If it makes you feel better keeping it in a fridge, that's good. But really, you shouldn't need to. In terms of contamination of the drops, obviously, that's down to how you apply it. You always drop it from above, and you don't give any potential for contamination from the eye to go back into the container. And whenever I've used it, and I've used it in quite a number of cases, then certainly we've only had to use it, we've had complete resolution in 48 hours, but we've probably carried on using it for 4 or 5 days, and that's it. So, it's not been sitting around a long period of time. But, good practice is perhaps to have it in the fridge, but I don't think it's really an issue. Fred Reyes is saying, what are F10's credentials for COVID-19? Thank you very much for asking I can see that Linda Muller, who's the sales director of health and hygiene, has already provided an answer. And of course, quite rightly, if you go to the F10 Products website, you can look up the COVID test result. And the simple answer is it works wonderfully well. It is, it has been laboratory tested to prove that it is efficacious against COVID. But we're here, and Molly's enjoyed it so much. If anyone's got a last question for Molly, or me, we don't mind. We're very willing to answer another question or two if anyone's got any burning issues. I don't think they have. So I think it just leaves me to thank you once again, Molly. It's been an absolute pleasure and a real delight having you with us. And I'm quite confident that a lot of our delegates will have learned a tremendous amount in a very nice and relaxed way from someone who has passion and knowledge and understanding about treating these lovely patients. So thank you so much for sharing your experiences and your knowledge with us. Thank you, Molly.
Once again, it was a pleasure. Thank you very much for inviting me.
Okay, thank you to all our delegates who've attended. Great to have you with us. Do remember that this whole webinar will be recorded and available on the F10 YouTube. So colleagues who you're battling with, you're having coffee tomorrow and you said, you know what, I've been listening and they said I should do this, and people start arguing with them, tell them to go and look on the YouTube and have a watch for themselves. And, I can honestly say that both Molly and myself, we're not people to tell you something because it's going to sell more F10. We're people telling you what is good to treat your patients with, because we've done it for, in my case, 20 years. Molly, of course, is much, much younger than me. She's only been doing it a couple of, but anyway, it's, the point is we wouldn't tell you unless we honestly believed it was the right thing to be doing. So, if they need convincing, tell them to go and watch the website. Thanks for your time, everyone, and hope to see as many of you as possible next month. Thank you all.
Thank you, everybody. And I just want to say thank you to you as well, Dr. Neil Forbes. So just get you a good thank you for your preparation and for moderating tonight. Really, really good information. And to all our attendees, thank you for joining us. Have a very, very safe evening and a great rest of the week. We'll see you on the 7th of September. Good night.
Okay. Night, everyone.
Thank you. Okay. Good night.